Absolutely. And let's go ahead and start with women since you were talking about it. So let's talk about women and testosterone. Um, I think it's a little better than it used to be many years ago, but there's some people that still, erroneously think that women don't need testosterone. So tell us the truth, Dr. Escobedo.
Yeah, I mean, men and women, it's the balance between the masculine and feminine, right? We don't want to be all one or all the other. It's just nice to have a nice balance between the two. And that testosterone is that vitality. It's that life force. It's that allows us to have the confidence to move through the world and build muscle and have strong bones and have that libido and just be able to stand strong and confident in our lives, right? And so that's super important for us as women, right? We have this soft side, this mother side, this part of ourselves that's very, very feminine. But when we can balance that with the masculine, with the testosterone, it can really help improve our mood. It can help improve our vitality, our strength, our libido, our sleep. It's such a great hormone. It has so many positive benefits for both men and women. So just a matter of finding that healthy balance there.
Absolutely. Janet, what do you have to add to this conversation? I know you have educate women all the time about testosterone and the importance of it.
Right. So I think a lot of times, and Dr. Escobedo, you probably see this too, that we hit menopause and there's so many things changing, physically, mentally, and in relationships. And one of the things that I think that is really hard for women is the libido issue, because it's not something that we talk about to our primary. And I think also sometimes primaries, especially in Western medicine, it's like, oh, it's just part of life. So what do you have to speak to that? I mean, what kind of things are you seeing with your patients and how you see that that's helping them?
Yeah, you're absolutely right. I mean, it's not really brought up that much in the primary healthcare realm. And it's unfortunate because a lot of women, when they go through these transitions, they go in to see the regular doctors and then they're just prescribed antidepressants and, or they're told that they're depressed or, and it's just like, there's so much more to it than that. I mean, sure, having low testosterone and low other hormones they contribute a huge piece to your mood. And for women, a libido is so complex, it's our connections to ourselves, our own sexuality. It's connections to our partners. It's that mental piece. It's stress. It's this all the energy that we put out every day for our families and taking care of everyone else. And testosterone. I always tell women it's the main hormone that drives our libido, but it's more than that, right? We also have to approach it holistically, like we would approach. Hormones are just so interconnected, right? So it's also looking at the stress piece and our connection with ourselves and our family and our partners. But when testosterone comes online and you get that the free testosterone up and women are starting to feel really balanced, it can really help with libido and help with that vitality, that desire to just have that push.
So we mentioned a little bit about how testosterone can help treat or prevent depression. We see it all the time, or often in women that are menopausal, and all of a sudden they're depressed, and their primary care doctor will put them on an antidepressant like Prozac or Zoloft or name one. When in reality, it can be a hormone imbalance. So we talked about that a little bit, but what about the bone density? You talked about testosterone and bone density. I love this one, and it gets forgotten about so much. So will you hit on that a little bit more?
Yeah, testosterone is really important for helping to build bone. And when women go through that transition, when we go through menopause, we stop making estrogen. So estrogen is important for bone health because it prevents bone breakdown. But testosterone helps with building the bone. So it helps with the strengthening piece. And also with, when it helps, it's an anabolic steroid. So it helps us to build. Anabolic means to build, right? Build muscle, build bone, just to kind of build strength. And also by building muscle strength, it allows us to feel stronger. And if we're exercising and working out, we're building muscle, and that's helping to stimulate bone production and helping with stability. And that has such a huge role in longevity, right? If we can maintain muscle and maintain bone as we age, then that really helps us to live a longer, healthier life, right? We don't want to just live long. We want to live healthy. We want to live a long, healthy life, right? Where we have good stability, mobility, and strength.
Yeah, Jen, I know you have a strong opinion about testosterone and bone health. Please.
I do. So I am not in favor of some of the traditional pharmaceuticals that are being thrown at women, and you probably know exactly what I'm bringing up. I really, as a pharmacist, have some drugs that I would rather not be in my toolbox, and I don't like Fosamax and that whole group. Can you speak to that a little bit about your opinion about how you feel about some of those drugs that we're using to help women in osteoporosis or prevention?
Yeah, I mean, it's like this, like the pros and the cons, right? I mean, how much benefit are you getting out of it versus the cost and the side effects and the negative effects on the body? And we know that, when it comes to building bone, some of the most effective tools for helping to build bone is you know loading weight onto the bone. So something like an OsteoStrong or resistance training. So helping to really stimulate the bones and building. And so, there's so many other ways getting the nutrients in, getting the hormones balanced, the testosterone and the estrogen, and getting, that strength piece in, and putting all those pieces together is going to have a much bigger impact on your long-term bone health than it is just taking one of these medications that has a laundry list of side effects and is so bad for your health. So,
Well, I think what's interesting too, and there's like that I know of off the top of my head, the biphosphonates, and there's like two more classes like Forteo and things like that for those bone density drugs for osteoporosis. One thing that they all have in common is they are indicated for postmenopausal women. Well, it's like the bingo light goes on. They're all indicated for postmenopausal women. What do postmenopausal women lack?
yeah,
They lack hormones. I mean, so why don't we fix the problem instead of just treating the symptom of bone loss? Why don't we fix the problem about why they're losing bone and not building new bone and balance their hormones? That to me just is rational thinking.
yeah, absolutely.
And the analogy I like to give about testosterone for bone building for women is this. Men get osteoporosis also, but usually it's a little bit later than women usually, partly because men start out with stronger bones because of more testosterone. But women or men get osteoporosis also, but it's not from lack of estrogen. It's from lack of testosterone. So that's one of the things, we're taught in school all the time about how important estrogen is for bone loss. And yes, it is important, but we have to remember that testosterone, like you said, Dr. Escobedo, is the bone building hormone. It works in women just like it works in men. So we cannot forget about that when it comes to bone building benefits of hormones.
Yeah.